People of St. Martin, today I come to you on the Saturday before Easter to update you on our latest numbers as it pertains to COVID-19 response of government, as well as to update you on some of the measures that have to be taken as a result of our experiences in the field. As of today, April 11th, 2020, I can update you on the COVID-19 cases. Not much has changed in our numbers due to the fact that the planned testing that we had for this past 2 days did not take place due to the fact that not enough test kits are available. The test kits that we had expected to arrive today did not arrive. So we are awaiting those new test kits as we move forward in our COVID response. We, of course, do with what we have. So we must send all our tests at the moment to Guadeloupe. Therefore, at the moment, we have in self-quarantine, 133 persons, in self-isolation, 202 persons, and the other numbers did not change much, except that of the pending cases, now we have 4, as 3 new persons have been hospitalized at St. Martin Medical Center. That brings our total hospitalized to 4 at the moment. As you would have remembered, 1 person was in hospital in critical condition. He remains in a critical condition, and 3 more persons were hospitalized during last night. So therefore, that brings up our number of pending in terms of their status. Not sure yet if they are COVID-19 positive, but they are highly suspected of being COVID-19 positive, and they are also hospitalized and under care. Today, training sessions took place for all AMI personnel and volunteers. The requested personnel for St. Martin, consisting of 29 medical professionals who arrived on the island on April 7th and 8th to assist St. Martin Medical Center with COVID-19 patients. They were going through some trainings today. The training sessions for the 29 specialists from AMI Healthcare and the local medical volunteers continue. This would include refresher courses, crash courses for basic ICU care, CPSI training courses being carried out by SMMC's ICT department, and other essential training in order for these teams to provide the most efficient care possible to our patients. The AMI healthcare personnel have all traveled from the USA, and prior to their arrival, were tested negative for the COVID-19 virus. All the test results, and they have also been swabbed again by HCLS once arrived, and all of these came back negative as well. Also, as I mentioned earlier, the 3 patients are not confirmed COVID-19 patients. They are highly suspected, and one of them is from Saba. This brings a total of 4 related COVID-19 patients currently admitted to the St. Martin Medical Center, with 3 being in stable condition and 1 still in critical condition. Today, the ICU nurses from the AMI will work or continue to work with our staff in caring for these patients. So that is the staff at the St. Martin Medical Center. And this is an update that we received from the St. Martin Medical Center. The hospitainer, which in a meeting held yesterday, April 10th, with the Ministry of Public Health, Welfare and Sport in the Netherlands, the additional containers used to increase the ICU capacity here at St. Martin. A list of necessities based on the assessment for the hospitainer is being compiled for possible shipping, with the containers which was scheduled to arrive on April 18th and on April 23rd by air freight via Maastricht in the Netherlands. The hospitainer will also come with 3 staff for installation purposes who will arrive on KLM via Curaçao. This is in addition to the persons from the US who will be working in the hospitainer as well. I would like to thank the Medical Center for continuously updating us on the status of their patients, as well as the expansion of the care possibilities as we continue to work together, government and the Medical Center, to ensure that our COVID-19 patients, as well as the suspected patients, get the best possible care. We would also like to again extend our gratitude to the Netherlands for sending those ICU units, beds, and materials, as well as arranging for the medical professionals to come online as soon as they did. And we look forward to that continued collaboration as we continue to work out all the other needs related to this COVID-19 response. The next point I'd like to elaborate on is food distribution. Over the past 2 weeks, ESF7 has been distributing meal packages, as I have been updating, with their ESF7 team. The ESF7 team consists of social services, community development, community police, community leaders, as well as volunteers. Many volunteers who have over the past 2 weeks been packing and setting up boxes for distribution. We are down to the last of the 1,500 boxes that had been initially packed, and we expect that by Monday we would have distributed all of these packages. Today, the efforts were executed differently due to the fact that even though I have been asking for the general public to be patient and to be lenient, that we should be able to deliver without putting these persons who are volunteering in harm's way. As a result, we instituted a system today that allowed for some persons within the area where the deliveries were taking place to come to the area to pick up their packages. And also, taxi drivers and other volunteers were then used to take out the rest cases, the boxes and materials to the community within this area that I'm talking about. I understand that some people are feeling the strain of not being able to get their orders delivered or not having cash to be able to pick up the necessities. So as a result, we have adjusted the schedule somewhat. ESF7 will continue to distribute food packages with the assistance of the fire department as well as the post office. We have been offered this assistance, but due to the fact that the initial group was a very, let's say, confidential group, the social services wanted to be able to deal with their clients on their own. As we move over now to deal with the persons who have registered via the social impact assessment form, we will be employing more assistance as well as hopefully getting more assistance from within the community themselves who know there are persons within the community who are needy. Several lists have been distributed, and of course we have to do a lot of cross-checking because there are persons within the social development and community list who are not on the list of the community workers and vice versa. So we are looking to remedy that as soon as possible, and I ask your patience as we work that out so that we can ensure that all those who are in need will be able to get. Yes, I understand that as it would appear to some, the delivery system is not working optimally, but again, we are working with volunteers who are doing their best at this time, and we look forward to the community's cooperation as we improve on this day by day. Also, many more grocery stores have come on board today, including some smaller grocery stores that are operated by our Chinese nationals, and they are also taking orders for persons living within their district. Already after 1 day, many are saying that they have more orders than they can handle in a day. We had recommended that orders be taken between 8 and 10 o'clock and that deliveries be allowed to be made during the afternoon. Also to in order safety and security of all those who are taking part in this food distribution, we have asked that the grocery stores get in contact together with our Economic Affairs Department with taxi drivers and bus drivers living within that area who could assist in the distribution of ordered food supplies that have been ordered by these supermarkets from the community. I believe that with the help of the community leaders, as well as those who are really interested in being of assistance, the public bus drivers, as well as taxi drivers, working together, we will be able to facilitate more persons getting their deliveries in a timely fashion. I have seen reports from all over the world where it's taking 2 weeks up to a month to receive food via delivery. So especially since this is something that we're doing for the very first time, I ask for your patience as a community as we work on assisting each and every one. Also, to facilitate that more food orders can be handled by the supermarkets, I have now allowed that all disaster pass holders, as well as those essential workers working today And all these days in our medical health professionals, pharmacies, all of the emergency services, police, ambulance, and the fire department, as well as those nurses working at a St. Martin Home, White and Yellow Cross, those working with CPS. In fact, everyone who is working avidly for the COVID-19 response, you are allowed to now, with your passes, go into the food markets and do your own shopping. This will allow, since these persons are already allowed on the road, this will allow for the delivery system to ensure that you are only working with those persons who cannot be on the road. We still would like to be able to hold this lockdown down as much as possible, because in doing so, we can then really properly assess who is actually COVID positive and how we can mitigate the spread. Yes, I know that what I want, what you want, is not always achievable in the time that we want it. Again, St. Martin HCLS lab did get the opportunity to test and had a limited amount that we were reserving, especially for those persons in hospital and those who are isolated with severe cases. We continue to want to test more, but until we have all the test kits that we need, we won't be able to do so. In the meantime, we will be isolating as many patients as possible in our suspected cases as possible in order to mitigate that these persons will infect any others. As soon as we are able to really isolate all of the persons who have COVID-19 or COVID-19 symptoms, then we will be able to slowly release the lockdown and allow persons to go out. As it is right now, we have, with today's decision, allowed for all of the persons who are already allowed to be on the road to do their own food shopping. This takes away a lot of orders from the supermarkets and allows them then to concentrate on those people who are at home. Some people have been asking about banking possibilities. The banks did allow for the ATMs at their main branch to be open. Of course, as we loosen some of the holes, more ATMs will become current, so that especially those persons who are on the road, who are working, who are doing all the deliveries, etc., the medical professionals and all the other frontliners would be able to make use of other ATMs. I understand that also the banks are making arrangements to assist our seniors who will be getting their pension during the coming next week. We will be making special arrangements for them to visit the bank, as well as, if we get an indication that that's possible, for those who also have been paid late to be able to access funds. Some stories reaching me also indicated that persons have been paid but still have not been able to access their funds from their accounts. So we will be looking and discussing with the banks to ensure that persons can access their funds as soon as possible so that they can make their online orders or order via the telephone, as we have been doing WhatsApp, etc. I know this is a new reality for all of us here on St. Martin. In some of the developed countries, people have been ordering online for years. So this is something new for us. As we move forward, we are looking at doing different things within the community to alleviate the stress and tension for the people of St. Martin, and especially within our neighborhoods. As soon as we get some of the deliveries out, we will be looking at allowing within neighborhoods for some persons to be able to travel to as a curb pickup to pick up their food. Some of the supermarkets are very reluctant to have this, as they do not want to have large crowds, especially of persons gathering. Curbside pickup would not be for people on foot, but only for people in cars. I will announce when such an action will be possible, and as we move into next week, if things are calming down, if by Wednesday we can say that we have been able to deliver the majority of persons' food that have been ordering online, etc., we will then look into going into another phase. However, for this 2-week lockdown to be effective, it is best that at least for 2 consecutive weeks, a minimal amount of persons are moving around. So hopefully, with us allowing those persons who can now already go out in public for essential reasons to do their own shopping. Allow then the ones who have to stay at home to be able to do their orders and get them delivered in a short time. I really would like the people of St. Martin to understand that the persons out there delivering government's boxes to the needy are doing their best. Everyone is leaving their family to come out and contribute to yours. If you do not receive today, do not curse, do not argue. Send love. Thank these people so that when they come back the next day and you're on the list, you don't have to swallow the negative words that you have given to them today. Many people are suffering. We understand that, and we're doing everything within our power to ensure that no one goes hungry. The number that I have advertised yesterday, 711, is not actually supposed to be operational until Monday. But if it is an urgent, and I mean seriously urgent case, then please do call and let our social services know how deep your need is. Several persons who know of others that are suffering, this is a time for you to reach out, whether you make the order for them and have it delivered to their homes, or you make arrangements with ESF 7, which is headed by Joy Arnell and run by, as I mentioned, community police, community development, and all of the community leaders. Identify the community leaders in your neighborhood, in your district, and they will ensure that the food is delivered to you. Community development and community leaders are working hand in hand. And I think if everyone does their part, we will get through this as one of the best countries in handling our own people's situations. Nobody is perfect. We will make mistakes along the way, but each and every mistake we make is in an attempt to help you. Now, tomorrow is Easter Day, and even though it is Easter Day, we are allowing food deliveries. We are allowing persons who are in need, and I stress, in need, to be getting food. I have also noticed today while I was in Dutch Quarter at the distribution point that several people were coming and they had food in their homes. This is not what I call community. This is not what I call caring for your fellow man. Yesterday was Good Friday. Yesterday was a significant day in the Christian calendar because it is a day of sacrifice, when Jesus sacrificed his life for each and every one of us. Now, I'm not asking anyone to sacrifice themselves. I'm not asking anyone to go hungry. What I am asking is for those of us who have to allow the orders of those that do not have to be processed first. The food is not running out. You are not in a position at this moment to be scared, to be holding on to food and hoarding. Food is continuing to come into the country, and we are doing our utmost to get it to you. And the only way we can get it to you is by you being patient, registering on our social assessment program, and registering if you are not able to get online, calling, WhatsApping, messaging your community leader. Each of your community's leader is in contact with ESF 7, and we will do our best to work together to ensure that each and every one of you has what you need. Today, because of 2 calls that I got personally, I went to the supermarket and I picked up groceries. Everyone is doing their part. I want to thank each and every volunteer who has come out, who has taken away time from their family, who is now also exposing their own family to whatever is out there on the roads, and sacrificed for you, the people of St. Martin. Many can complain, but few are stepping up to help. I want to thank all those who are helping. I want to thank Marinka Gums of the Post Office for offering assistance from the Postal Services, as well as ESF2 for everything you're doing in terms of telecommunications, in putting back phones for seniors, even though their money has run out. Thank you, BTP, for everything you're doing. Thank you to each and every ESF coordinator from 1 to 10 for everything that you are doing to assist us. Thank you to those taxi drivers and bus drivers that will tomorrow be assisting our small grocers in getting the food out to the people in the community. Let's work together. Let's do this as a united community. I believe that with this being said, I have passed even my prepared statements and what I wanted to say for today, but I would like to commend all those businesses that I have gone to and seen that your workers are protected. They're all wearing masks. They all seem healthy, but I must say they are tired. So put your hands together and say a prayer tonight. Say a prayer tonight for all those persons who are working overtime for you. Every single one of them deserves a prayer, deserves your thanks, and even if we're not getting it 100% right, we are doing our very, very best. Thank you from the people of St. Martin. Thank you to all our frontliners, and may God continue to bless each and every person on St. Martin.